It just really reminds me how complicated grief is. Going back to what we started with, which was our pets, our patients. When a client loses a dog, for example, they don't just lose the dog, but they lose that daily routine of taking the dog for a walk or the daily presence of like their dog in the office while they work. I remember when I first got hired at the Ontario Vet College after my residency, and there was a very renowned surgeon who had been there for a very long time who had suddenly passed away before I arrived. You could see that when people talked about this surgeon that they were very emotionally affected. And one of the biggest things that I heard from the residents in training was I was so looking forward to working with him or learning from him or all of these things. So it's again not just the loss of this colleague, this friend, this mentor, but this loss of what could have been. It's just so multifaceted.
It's not only multifaceted, but it can be compounding. So
Mhm.
if you had that mentor that just reminds you of your grandfather who you lost too, like now you're feeling that loss and your grandfather's loss.
Ah.
So many things that can get wrapped up in it. It might feel selfish because, you know, that professor you hadn't even met, but
Mhm.
you could look forward and be like, oh man, I was really looking forward to learning from that person. That's a loss for me. And we shouldn't feel selfish when we feel that kind of grief because it's a feeling and that
Mhm.
is truly how you're feeling. And that mattered to you. It doesn't matter that you didn't know him. What you were dreaming about isn't going to happen now. And that is a loss.